To the understanding of neurological disorders is to know the difference between upper motor neuron lesions and lower motor neuron lesions. Most of the time we're aware of the differences between the two kinds of lesions but are unaware of the definitions and what actually is the meaning of upper motor neuron and lower motor neuron. If we know the meaning and definition or concepts and building on the concepts of neurology will become much easier, and similarly our practice will become better. So what are the upper motor neurons? They start from the motor cortex in the precentral gyrus and go to the cranial nerve nuclei in the brainstem if they're controlling something around the head, or the anterior horn cells in the spinal cord if they're controlling the body. So the upper motor neurons span from the motor cortex to the cranial nerve nuclei or the anterior horn cells in the spinal cord. The lower motor neurons start from exactly where the upper motor neurons ended. They start from the cranial nerve nuclei or the anterior horn cells and go to the motor end plate of the muscles. There are some pertinent differences which are very helpful clinically to differentiate between upper motor neuron lesions and lower motor neuron lesions. Let's briefly go through them. Upper motor neuron causes a spastic paresis with increase in tone, and lower motor neuron lesion causes flaccid paralysis with decrease in tone. Atrophy is more present in lower motor neuron type of lesions. Deep tendon reflexes increased in upper and decreased in lower. And Babinski sign might be present in upper motor neuron lesions. Superficial reflexes, especially pertinent when you are dealing with a case of spastic paraplegia. They might be absent in upper motor neuron lesions and they are present in lower motor neuron lesions, especially the abdominal reflex if you check that one out. And fasciculations and fibrillations are present and can be present in lower motor neuron lesions. It's really important sometimes, especially in disease such as motor neuron disease, to find out if there are fasciculations or not and put it on lower motor neuron type of weakness. So just to revise, upper motor neurons from the motor cortex to the cranial nerve nuclei and the brainstem or the anterior horn cells in the spinal cord. Lower motor neuron lesions from there, cranial nerve nuclei or anterior horn cells to the motor end plate of the muscle.